Good afternoon, dear student. Today we'll discuss the rest of the radiology of tuberculosis, and this is part 2. As we will notice at the end of our discussion that tuberculosis is a disease which involves virtually every part of the body, including the hollow organs and the solid organs, the central nervous system, the musculoskeletal system, and it spares no system of the body. Now, coming to the tuberculosis of the liver and the spleen, as we know, these are the solid organs, including the adrenal glands. In this picture, you can see the hepatic tuberculosis. Axial contrast enhanced CT scan demonstrates multiple non-uniformed, low attenuated lesions within the liver, demarked by the straight arrows, and enlarged gastrohepatic lymph nodes, also seen with the curved arrow. Adrenal tuberculosis. Axial contrast enhanced CT scan demonstrate bilateral adrenal masses with central low attenuation areas, which show the degeneration or the changes which involve the central organs with destruction of the organs. Cardiac tuberculosis, not very uncommon. This axial CT scan or axial T2 weighted MR image demonstrate tuberculoma of the right atrium in a patient with miliary tuberculosis, and this is axial T2 weighted magnetic resonance MR image, which demonstrates hyperintense mass in the right atrium, marked by the straight arrow. And you will note also the right pleural effusion is marked by the curved arrow. The mass proved to be tuberculoma at surgery. Tuberculous pericarditis in a patient with pulmonary tuberculosis. Axial CT scan demonstrates pericardial thickening, marked by the straight solid arrow, and pulmonary tuberculoma, curved arrows, and a right pleural effusion marked by an open arrow, which can also be seen. Skeletal tuberculosis. No, this axial skeleton and extra-axial skeletal lesions. Tuberculosis or tuberculous spondylitis. This is sagittal T2 weighted MR image. Demonstrate areas of increased signal intensity, which is due to the edema in the vertebral bodies, accompanying disc narrowing, white arrow, and an extension of the disease into the spinal cord, black arrow, which lead to the compression of the spinal cord at this level. Simple X-ray, lateral view, subligamentous spread of the spinal tuberculosis. This is ALL, anterior longitudinal ligament, erosion of the anterior margin of the vertebral body, marked by arrow, and adjacent soft tissue abscess. Another X-ray of the lumbosacral spine, lateral view. This tuberculous spondylitis, lateral radiograph demonstrate obliteration of the disc space, straight arrow with the destruction of the adjacent end plates, curved arrow, and anterior wedging, leading to the kyphosis. Calcified sauce abscess. Axial CT scan demonstrates bilateral tuberculous sauce abscess with peripheral calcification, marked by the solid short arrows. Another CT axial view at the level of sacroiliac joint, iliopsoas abscess, Axial CT scan demonstrates large multiloculated iliopsoas abscess bilaterally marked by the arrowheads. Note also the presacral abscess marked by a solid arrow accompanied by erosion of the anterior sacrum open arrow. Yet another case, tuberculous spondylitis, axial CT scan demonstrates iliac destruction of the vertebral body marked by a black arrow with an adjoining soft tissue abscess, white arrow. Tuberculous involvement of the left sternoclavicular joint, oblique radiograph demonstrates irregularity of the medial end of the left clavicle marked by black arrow with an associated soft tissue mass marked by white arrow. Now tuberculosis or tuberculous arthritis. Again, not very uncommon thing. Now this is an MR image, sagittal view, tuberculous arthritis of the ankle joint, sagittal T1 weighted MR image, demonstrates hypointense periarticular effusion marked by black arrow and bone erosion and of the talus and tibia marked by the white arrow. Simple wrist radiograph, tuberculous osteomyelitis. Anteroposterior radiograph demonstrates a lytic area of the bone destruction marked by arrow with transphysial spread of the infection across the growth plate. Another X-ray, tuberculous arthritis of the knee joint. Frontal radiograph demonstrates periarticular osteopenia, black arrow, peripheral osseous erosions marked by the white arrow, and relative preservation of the joint space. Now this is MR image, tuberculous arthritis of the knee joint, sagittal post-gadolinium enhanced study. T1 weighted MR image demonstrates peripheral enhancement around the low signal intensity, joint collection, straight arrow, and note the presence of the marginal joint erosion marked by the curved arrow. Tuberculosis of the central nervous system. Now cranial tuberculosis or tuberculous meningitis, axial gadolinium enhanced T1 weighted MR image demonstrates the involvement of the meninges on the left side, the sylvian fissure along with the curved arrow indicating a tuberculoma. Again, central tuberculosis, axial contrast enhanced CT demonstrate multiple ring enhancing lesions marked by straight arrows along with the diffuse meningeal enhancement. So these are all tuberculomas. Solid erosion, solid caseating tuberculous granulomas involving the cerebellum. This is axial T2 weighted MR image which demonstrates multiple granulomas with central areas of hypointensity in the cerebellum marked by the arrows. Tuberculous granulomas involving the cerebellum. This is the axial CT, high resolution, bilateral tuberculous mastoiditis, high resolution CT scan of the temporal bone demonstrates bilateral destructive lesions in the mastoid processes marked by the straight arrows. Now, tuberculosis involving the genitourinary system is again not very an uncommon condition. Here you can see the renal tuberculosis marked by black solid or short arrow. Chest radiograph that includes the upper abdomen demonstrates lobar calcification in the right kidney. Black arrow. Note also the bilateral fibrocalcific changes in the upper lobes. White arrows. So tuberculosis in the lungs, ultimately invading the renal system. CT scan, renal tuberculosis. If you can see on the left of the screen, the kidney is almost destroyed with the presence of a large multicystic lesion, arrows and paraspinal or sauce abscess on the left side. Tuberculous pyonephrosis. Retrograde pyelogram shows filling of the dilated hypernephrotic lower and hydronephrotic lower and middle pole of the right kidney. So it causes strictures and ultimately there are focal areas of hydrocalyx, hydronephrosis and obstructive nephroluropathy. Now, endometrial tuberculosis. This is hysterosalpingography, which demonstrates an obliterated and deformed endometrial cavity due to the tuberculous endometriitis. Bladder tuberculosis, urinary bladder tuberculosis, axial contrast enhanced CT scan demonstrates a thickened and deformed bladder with an enhancing wall marked by the straight arrow. Bladder tuberculosis, intravenous urograph demonstrate a thick and contracted low capacity bladder, which is called the thimble bladder, marked by the arrowheads with minimal dilation of both the ureters. Ocular tuberculosis. Here you can see an axial CT. Orbital tuberculosis, contrast enhanced CT scan demonstrates an enhancing retinal lesion in the left orbit marked by an arrow. Now the take home message for the tuberculosis of the body, which involves the various organs. It says tuberculosis can affect virtually any organ system of the body and can be devastating if left untreated. Tuberculosis has a variety of radiological appearances which can mimic many other diseases or many other disease entities. A high degree of clinical suspicion and familiarity with various serological manifestations of the tuberculosis allows early diagnosis and timely intervention of the appropriate therapy, thereby reducing patient mortality. Now this is today's assignment. What are the 3 different varieties of intestinal tuberculosis? Now students, you can mark your presence by answering at my email, which is given below. And one thing is very important, this would be the last chance for you to mark your presence in all my lectures. Thank you very much.